Hey guys, my name's Caitlin, and today we're going to talk about immunity. First of all, what is the difference between active and passive immunity? Active immunity is the direct response of your body against the pathogens. That's when your body makes the antibodies. Passive immunity is when antibodies are created by another human or animal and they are transferred to the patient. What is the difference between active natural and active artificial immunity? Active natural immunity is when a live pathogen enters the body naturally, like through droplet or contact. For example, if the person was to get the flu or strep or Lyme disease, then that person gains those antibodies like naturally. Active artificial immunity would be like when a person gets a vaccine, like a vaccine for the flu or something like that. Then the body creates antibodies from that vaccine that they have received. What is the difference between passive natural and passive artificial immunity? Passive natural immunity occurs when antibodies are passed from the mother to the fetus through the placenta or to the baby through breast milk. This type of immunity is only temporary for the baby. Passive artificial immunity is when antibodies in the form of immunoglobulins are administered to a patient who requires immediate protection against a disease when the exposure has already occurred. An example for this would be if a person was bitten by a poisonous snake, then they would get this antivenom. What is the TD vaccine and the Tdap vaccine? How are they different, and what are the recommended doses for adults? The TD vaccine is like a booster for the tetanus and diphtheria toxoids. The Tdap vaccine is tetanus, diphtheria toxoids, and acellular pertussis. The Tdap is a routine vaccination. If they previously did not receive the Tdap at or after age 11, then they should receive 1 dose of Tdap, then a Tdap booster or a TD booster every 10 years. For special situations such as previously not getting the primary vaccination series for tetanus, diphtheria, and pertussis, they should receive 1 dose of Tdap followed by 1 dose of TD at least 4 weeks after the Tdap. At least 4 weeks after the Tdap, and another dose of the TD booster 6 to 12 months after the last TD booster. The Tdap can be substituted for any of the booster doses, but the preferred as the But the TD, can be substituted for any TD dose, but preferred as the first dose. The Tdap is preferred as the first dose. Sorry, messed that up. The TD booster should be given every 10 years thereafter. During pregnancy, 1 dose of the Tdap during each pregnancy, preferably in the early part of gestational weeks 27 through 36. What is the MMR vaccine and the varicella vaccine? What are the recommended doses for adults and contraindications for each vaccine? The MMR protects against measles, mumps, and rubella, and the VAR is the varicella or chickenpox vaccine. For routine vaccinations with no evidence of immunity to measles, mumps, or rubella, the patient should receive 1 dose of MMR. With evidence of immunity born before 1957, except for healthcare personnel, documentation of receipt of MMR, lab evidence of immunity or disease, and the diagnosis or disease without lab confirmation is not evidence of immunity. Special situations for this: during pregnancy with no evidence of immunity to rubella, MMR is contraindicated during pregnancy. After pregnancy, they should receive 1 dose of MMR. Non-pregnant women of childbearing age with no evidence or immunity to rubella should receive 1 dose of MMR. HIV infection with a CD4 count greater than or equal to 200 cells for at least 6 months and no evidence of immunity to measles, mumps, or rubella should receive a 2-dose series of MMR at least 4 weeks apart. MMR is contraindicated in HIV infection with a CD4 count of less than 200 cells. In severe immunocompromising conditions, MMR is contraindicated. students in post-secondary education institutions, international travelers, and household or close personal contacts of immunocompromised persons with no evidence of immunity to measles, mumps, or rubella. They should receive 1 dose of MMR if previously received 1 dose of MMR, or 2-dose series of MMR at least 4 weeks apart if they previously did not receive an MMR. Healthcare personnel born in 1957 or later with no evidence of immunity to measles, mumps, or rubella should receive a 2-dose series of MMR at least 4 weeks apart for measles or mumps, or at least 1 dose for rubella. If born before 1957, consider the 2-dose series of MMR at least 4 weeks apart for measles or mumps, or 1 dose of MMR for rubella. Varicella, with no evidence of immunity to varicella, they should receive a 2-dose series of VAR 4 to 8 weeks apart if they previously did not receive varicella-containing vaccine. If they did previously receive 1 dose of varicella-containing vaccine, then they should receive 1 dose of VAR at least 4 weeks after the first dose. VAR is contraindicated in pregnancy, HIV infection with CD4 count less than 200 cells, and severe immunocompromising conditions. What is the pneumococcal vaccine, and what are the 2 different types available? What are the recommended doses for adults and contraindications for both pneumococcal vaccines? The pneumococcal vaccine is available as pneumococcal conjugate, PCV13, or pneumococcal polysaccharide, PPSV23. Adults 65 or older who are immunocompetent should receive 1 dose of PCV13 if they previously did not receive PCV13, followed by 1 dose of PPSV23, at least 1 year after PCV13 and at least 5 years after the last dose of PPSV23. If they have previously received PPSV23 but not PCV13 at age 65 years or older, they should receive 1 dose of PCV13 at least 1 year after PPSV23. When both PCV13 and PPSV23 are indicated, administer PCV13 first, and the 2 should never be administered during the same visit. For special situations, aged 19 through 64 years with chronic medical conditions, like chronic heart and lung or liver disease and diabetes, alcoholism, or cigarette smoking, they should receive 1 dose of PPSV23. At 19 years or older with immunocompromising conditions such as congenital or acquired immunodeficiency, including B and T lymphocyte deficiency, complement deficiencies, phagocytic disorders, HIV infection, chronic renal failure, nephrotic syndrome, leukemia, lymphoma, Hodgkin disease, generalized malignancy, iatrogenic immunosuppression such as drug or radiation therapy, solid organ transplant, multiple myeloma, or anatomical or functional asplenia, including sickle cell disease and other hemoglobinopathies, should receive 1 dose of PCV13 followed by 1 dose of PPSV23 at least 8 weeks later, then another dose of PPSV23 at least 5 years after the previous PPSV23. At age 65 or older, administer 1 dose of PPSV23 at least 5 years after the most recent PPSV23. Note, only 1 dose of PPSV23 is recommended at age 65 or older. Age 19 years or older with cerebrospinal fluid leak or cochlear implant should receive 1 dose of PCV13, followed by 1 dose of PPSV23 at least 8 weeks later. At 65 years or older, administer another dose of PPSV23 at least 5 years after PPSV23. Note, only 1 dose of PPSV23 is recommended at age 65 or older. What are all the different types of hepatitis vaccines available? What are the adult dosing schedules for each vaccine? There are 3 different Hep vaccines. There are Hep A, Hep B, and Hep A and B. The adult dosing schedules for each of these are: Hep A is a 2-dose series, either Havrix 6 to 12 months apart or Vacta 6 to 18 months apart with a minimum of 6 months. Or the 3-dose series Hep A, Hep B, which is the Twinrix at 0, 1, and 6 months. The minimum intervals are 4 weeks between doses 1 and 2, and 5 months between doses 2 and 3. Hep B, 2 or 3 dose series Hep B, the 2-dose series of Heplisav B, at least 4 weeks apart, or 3 doses of Ingerix B or Recombavax HB at 0, 1, and 6 months. The minimum intervals are 4 weeks between doses 1 and 2, 8 weeks between 2 and 3, and 16 weeks between doses 1 and 3. Or 3 doses of Hep A, Hep B Twinrix at 0, 1, and 6 months. Minimum intervals 4 weeks between doses 1 and 2, 5 months between doses 2 and 3. What is the influenza vaccine and how many different types are available? What vaccine could you recommend to a patient with an egg allergy? The influenza vaccine protects you from the flu. There are 3 different types available. The influenza inactivated, the influenza recombinant, and the influenza live attenuated. If a patient has an egg allergy with hives only, 1 dose of any of the types is okay to give, depending on which type they should receive for their age and health status. If the patient has an egg allergy more severe than hives, such as angioedema or respiratory distress, the patient can receive 1 dose of any of these types that is available for their age and health status, but only in the presence of, in the medical setting, under supervision of a healthcare provider who can recognize and manage severe allergic conditions. What is the HPV vaccine and what are the recommended adult doses? Which types of HPV does the vaccine protect against? The HPV vaccine is the human papillomavirus vaccine. Recommended adult dosage is 2 or 3 dose series depending on age at initial vaccination. Male ages 22 to 26 may be vaccinated based on individual clinical decision. The HPV vaccine is routinely recommended at age 11 to 12 years. 15 years or older should receive 3 dose series at 0, 1 to 2, and 6 months. The HPV vaccine protects against certain types of HPV that can lead to cancer or genital warts. The types of HPV they protect against are types 16 and 18, which are the types that cause 80% of cervical cancer cases. What is the zoster vaccine and the Shingrix vaccine? How are they different? The zoster vaccines are 2 vaccines that have been shown to reduce the rates of herpes zoster. One type is essentially a larger than normal dose of the chickenpox vaccine, as both shingles and chickenpox are caused by the same virus, the varicella zoster virus. The Shingrix vaccine is indicated for prevention of herpes zoster, which is shingles, in adults that are 50 years or older. Shingrix is not indicated for prevention of chickenpox. Thanks for watching, guys.